Good morning, everyone. I want to acknowledge our Commissioner of Public Health, Dr. Arwady, who's here with us, and we're going to be talking about kind of where we are in the arc of our pandemic, our response, and what we need to do to make sure that we continue to keep Chicago safe. Since the very beginning of this health crisis, we have been committed to tackling COVID-19 head-on with a disciplined, data-driven approach. And we've seen how that manifests itself in a number of things that we've done to keep Chicagoans safe, including our racial equity rapid response team. And most recently, our rollout of COVID-19 Recovery Task Force report. Today, we're coming before the public because we want to make sure that we are alerting you to vital information before we have to take any specific action. We believe that providing the public with additional information, more information, highlighting the information that's out there will provide individuals with the tools that they need to do their part to make sure that we all continue to keep Chicago safe before we have to take any additional steps. Right now, our priority is keeping the numbers of new cases as low as possible, especially among our young people, caring for and saving the lives of those who are sick, and doing everything in our power to stop the spread of this disease. Make no mistake, every single decision that we've made, really going back to March, so for 4+ months, has been difficult. It's not been easy, but we've been guided by the public health metrics, and we will continue to make the decisions that we believe are necessary to keep Chicagoans safe. I want to take this moment to thank all of you out there who have been staying home when able, socially distancing, wearing face coverings in public, and complying with the city and state guidelines. Your sacrifice, your adherence to the public health guidelines truly has saved lives of your fellow Chicagoans. Make no mistake about that. You are the reason that everyone has the ability to have some semblance of a normal life because of the hard work that you have done every day since this pandemic hit Chicago. And on behalf of your fellow Chicagoans, I want to say thank you, and please keep up the great work. Unfortunately, there remain some of you who are still not getting the very clear messages we have been sending now for months. So hear this. Despite the fact that the weather might be warm, COVID-19 is still here in Chicago and will be part of our future for the foreseeable future. Yes, our metrics are tracking better than the rest of the country, but that doesn't mean that we can ever let our guard down. It means our precautions are working and that we need to continue to be diligent. And I want to specifically address some of the younger people in our city, the 18 to 29-year-old cohort. Folks, you are not immune to COVID-19. The reality is actually quite different, and the data proves it. Unfortunately, since June 15th, nearly 30% of the new cases in Chicago have come from those who are 18 to 29. And we're seeing these increases across race and ethnicity and all over the city. And this should be the proof that you need. If you are in the 18 to 29-year-old cohort, you are catching COVID-19. You are getting sick. And you're not only putting yourself at risk, you're putting every single person that you come into contact with at risk as well. So what can you do right now, 18 to 29-year-old Chicagoans? What can you do to turn this around? Number one, minimize gathering in large groups. I repeat, the larger the group, the higher the risk that someone in that group has COVID-19. So minimize gathering in large groups. Number 2, wear a face covering when you leave your house. Everywhere. Not just some of the time, but all of the time. That's critically important to reduce the spread. And number 3, spread the word, not the disease. What I mean by that is you need to be an ambassador for the public health guidance. Tell everyone in your network, tell your family members, tell your friends that if they do the things that you should be doing, which is minimize gathering in large groups, wear a face covering everywhere, social distance at all times, follow the hand hygiene guidance. If you spread that word, you will be not only protecting yourself, but your family, your friends, and everybody in your network that you care about. Let these numbers be yet another reminder that we have to do the right thing in this moment. Some of you have joked that I'm like the mom who will tear the car around when you're acting up. No, friends, it's actually worse. I won't just turn the car around. I'm going to shut it off, I'm going to kick you out, and I'm going to make you walk home. That's who I am. That's who I must be for you and everyone else in the city to make sure that we continue to be safe. But I don't want to be that person if I don't have to. But I will if you make me. And right now, we are on the precipice. We are dangerously close to going back to a dangerous state of conditions. And Dr. Arwady will talk about that in a moment. So folks, we gotta get this right. We gotta continue to do the right things. If you are a business, we're not afraid to shut you down, and we've proven that. So please step up and do the right thing. Follow the guidance that you know is in place to keep your workers, to keep your customers, and to keep you safe. This should go without saying, but I'm going to say it anyway. This vicious disease has already taken millions of lives around the world. And unfortunately, we're seeing the consequences of that every single day. We do not want to be like other parts of the country that are straining under the burden of new cases and having their healthcare systems on the verge of collapse. We feared that in Chicago in March. But we avoided that because each of you who has done the right thing understood the necessity of the moment, the sacrifices that needed to be made to make sure that we were all going in the same direction to keep Chicago safe. Now, having been through this experience, the last thing I want to do is have to take steps back. I certainly don't want to be like other places of the country where we're shutting down commerce and business again. We fully recognize the hardship that this has placed on everyone. But if we must, we must. And it depends upon each and every person to do the right thing. Because the problem isn't just that you're hurting yourself. The problem isn't just that you're hurting people in your network. You're hurting the whole city. If we continue to see this uptick in cases, we're going to have no choice but to go back into phase 3. That means shutting businesses down. That means imposing more restrictions on your mobility. No one wants to go back there. But we will have to go back there if people continue to ignore the public health guidance. So folks, this is our moment of reckoning. This is our moment of whether we are going to do the right thing in our city. It is going to determine whether businesses continue to stay open. It is going to determine whether or not we continue to have some semblance of a normal life. I hope that the answer is yes. But it's up to you, and we'll see that reflected in the public health guidance. So please be smart, please be safe, and do everything that you can to make sure that Chicago continues to move forward in the face of this continuing pandemic. That is my hope. That is what the message that we are bringing today. And I hope that everyone who is out there listening. We'll do everything we can. Double down on what you've been doing if you've been doing the right thing. And if you haven't been doing the right thing, now is the time to wise up, be smart, and be safe. And at this point, I'd like to ask Dr. Arwady to come to the podium. Doctor.
Thank you very much, Mayor Lightfoot. So my goal today is to show you some data that you can follow right along with us. This is the same data that is available on the dashboard, chi.gov/COVID-. We update it every single day, and the health department uses this exact data. We've made transparency a hallmark of our response from the beginning, and we will continue to show the data, good, bad, or in the middle. Yesterday, when I was doing my Facebook Live update, I got a question. You have so much data on your website. What is the first thing you look at? And it's this number. Every day, right up on the top left of that dashboard, you see our new confirmed cases. That is the average number of new cases that are being added every day here in the city of Chicago. And today, we are at 192 new cases. That means that across all ages, race, ethnicities, gender, geography, in total, on average, 192 cases. This, if I had one number, is the number that I follow. As long as we're doing our job on the health department and the city end to make sure that we keep our testing rates where they need to be, which we are doing, this is our best reflection of the burden of disease. You can see in the graph on the right that we've come a long way in terms of this number. Where you go back to the peak at early May, we were adding more than 1,000 new cases per day. And so the fact that we are now under 200 is excellent progress, but we're a long way from done, and I want to highlight that that 200 number does have importance. So what does 192 cases per day mean in the grand scheme of COVID as we look at our numbers and compare ourselves to other places across the country? So we've done the math for you here to build in Chicago's population and turn this into a round number so that people can understand it. As long as we stay under 200 cases, in that 100 to 199 range, we remain in what is called a moderate high incidence state. That's a CDC term, but it basically means that we are out of high incidence. We're not yet into moderate incidence, moderate low incidence, or low incidence, but it tells us how much COVID is here right now. These are the numbers that we use when we're calculating the risk that in a gathering of a given size, how likely is it that someone will have COVID in that gathering? And so where we look at that number and match it up to our risk, this is how we make decisions about what we need to do at a city level. In green there, if we're able to get this confirmed cases per day down under 100, which I think is possible, that's when we'd be moving ahead. That's when we'd be expanding our gathering sizes. Certainly, there's lots of conversations about the ways we'd like to continue to reopen, but we need that case number on the decline and really down below 100. If we see it go the other way, as soon as we are back over 200, and I say as soon as, because I do expect, given what we are seeing around the country, that we will likely see some additional increases here. When we get back above 200, we're back in a high incidence state. And for me, that means we are back in a caution state. It does not equal an automatic rollback. What we do when we are over 200 new cases is look at our local epidemiology, our local data, and say what is driving that increase. So if we see, for example, a lot of cases that are associated with bars. Bars would be one of the earlier things we might think about needing to roll back. If we're seeing pockets in long-term care facilities again, We would double down on our efforts in long-term care facilities. We'll use the data to make the decisions if we need to make structural differences in our guidance. I do want to point out, though, that 400 plus cases. That, again, would be approximately twice the number of cases that we are at right now. But if we get to a point where we are up to 400 cases per day, that's the equivalent of where the states are that we are requiring quarantine for our visitors. It's the equivalent of needing to go back to a phase 3, really pulling back on major activities. I wanted to make the point with the mayor that we're quite close to 200 here. We'll start thinking about pulling back if we need to once we're over 200. There are other things that play in there. How fast are we seeing a rate of increase? What's happening with our percent positivity? Are we seeing any impact on the healthcare system? We continue to follow all of those metrics, and they all play into our decisions. But for you following every day how we're doing in Chicago, that's the number I want you to watch, and I want you to help us, as the mayor said, drive that number down. It's how we move ahead in Chicago and not backwards. I also just want to highlight that we are doing more testing in Chicago than we've ever been doing. We set as a goal that we needed to be doing at least 4,500 tests per day. That means that we're testing 5% of Chicago residents per month. Our current average is at 5,562 tests per day, sufficient to where we are. We'd like to continue to grow that, but it's good and been going up. So this is not that we're testing less, for example. Our percent positivity can be calculated 2 different ways, and I'm going to mention this just because we've been getting a lot of questions about it. If you look on our dashboard right now, we calculate our percent positivity by the number of positive tests divided by the number of individuals who are tested. We only count an individual once. However, many other jurisdictions do use the total number of tests performed. So if an individual has had multiple tests done, those would be counted multiple times. And so overall, the way that we've been reporting on our dashboard, we're at a 5.3% positivity, and that's an increase. We'd like that number to be below 5%. We're working to drive it down. But where we're comparing across jurisdictions, in many cases, that lower number, that 3.5%, is actually where we are as a city. It's not that one is right and one is wrong. There are different ways of counting the percent positivity. We use this data to drive resources to where they are most needed. Where we are seeing the highest percent positivity in the city is where we push pop-up testing. It's where we do extra investigation. It's where we do additional outreach, and we will continue to do that. Our daily hospitalizations and deaths look great at this point. Our hospitalizations continue to decline. We have fewer people, by and large, hospitalized, fewer people in the ICU, fewer people on ventilators in Chicago than we've had for COVID at any point since March. We also have fewer deaths per day than we've had at any point since March. At the peak, we were averaging almost 50 deaths from COVID-19 every day here in Chicago. We're now down to 4 deaths per day. And we've had a few days with just 1 death. I anticipate likely soon we'll have our first day, finally, with no COVID-19 deaths here in Chicago. But this progress is because we've managed to keep our cases relatively flat. If we start to see significant increases in those cases, hospitalizations and deaths likely will follow. And that's what we're seeing around the country. In other jurisdictions that have seen major increases, the jurisdictions where we've put quarantine in place for people returning to Chicago, they are now starting to see those increases in hospitalizations and in deaths. We do not want that here in Chicago. We do not need to see that here in Chicago if we can continue to do the things that have gotten us this far. Finally, I wanted to talk a little bit about what we're seeing related to age groups, because this is a really important part of the story. This is, again, data right from chi.gov/COVID-. I encourage you to explore it. This shows what our daily case rates have looked like by age group, all the way from March through July. So do you see that gray peak in May? That was in Chicagoans who were over the age of 80. So in early May, where we were seeing all those deaths, that's when we were seeing a lot of cases, especially in long-term care, a lot of people with underlying conditions being admitted. Our older Chicagoans were seeing the most cases. We've made really good progress there. And if we move ahead to what's happening today, that blue box shows you really over the last month. Yep, go ahead. And now instead, we are seeing the most cases in Chicagoans who are 18 to 29, followed by 30 to 39, followed by 40 to 49. Our case rates in older Chicagoans who are more likely to be hospitalized or to die are the lowest, not counting the youngest children under 18. And that's great. But younger Chicagoans are not immune to serious complications from COVID. National news was made here in Chicago when a young woman in her 20s without significant underlying medical conditions needed a double lung transplant for COVID-19. We have seen hospitalizations and we have seen deaths, even in these younger age groups. But also, people in these age groups spread COVID just as easily as someone who is older. And so especially if you're in a younger age group, I'm not surprised that you're out more. You're at a lower risk, it is true, for these serious outcomes. But if you have in your close circle people who have underlying conditions, or especially people who are in those older age groups, I also need you, in addition to all the things that the mayor mentioned that help protect the spread generally, I need you to be extra careful with those vulnerable folks in your life. Because you could have COVID and not even know it. It's been one of the things that's made this disease hardest to spread. And what we don't want to see is those cases in our younger Chicagoans in a few weeks translating to increases in older Chicagoans. So since June 15, 29%, most new Chicago cases have been in that younger adult age group, and you can see the drop moving forward. And where we look at race and ethnicity, it's no secret here that most of our recent cases have been among Latinx Chicagoans. We've seen very, very good improvements there. Rates have been dropping. I really want to thank everyone in that community that has been working so hard to control the disease, to get the message out, to push testing, to push investigation. And you can see that among Chicagoans 18 to 29, again, going back to June, we've seen some drop off in terms of cases, but still relatively high rates among younger Latinx Chicagoans. We've seen the most increase among white non-Latinx Chicagoans in that 18 to 29-year-old group. And among black non-Latinx Chicagoans, you can see it's sort of been meandering a little bit up and down. The bottom line is that we are seeing these cases among all race ethnicities. This is a message for all Chicagoans to be careful. I also just want to highlight that our testing and our percent positivity have been relatively stable in this age group. So again, this is not just an artifact of changes in testing. And this is an important graph. It highlights that in virtually every zip code in Chicago, in our most recent week, we saw new cases, not just in Chicagoans, but in Chicagoans between 18 and 29. So every zip code just about is seeing cases. We're seeing the most new cases in the 18 to 29-year-olds in 60614, which is the Lincoln Park area. But the areas that are darker are where we are seeing more cases. The areas where is lighter is we're seeing fewer. But the bottom line is we're seeing these cases throughout the city. Where we're seeing changes in COVID cases, again, in that 18 to 29 for the most recent week. We see the increase again in that Lincoln Park area, as well as in New City in the south. The areas that are in green are where we're seeing decreasing rates. The areas that are in orange and red are where we're seeing increasing rates. Again, bottom line, this is across the city, and we need everyone to take care. So, in summary, I'd like to just first of all, thank you all for having gotten us this far. Our healthcare systems, inpatient and outpatient, our community-based groups, individual Chicagoans have all stepped up to take care of each other. We've managed to keep a decision like whether to wear a face covering out of the realm of politics and in the realm of this is the right thing to do. When I wear this face covering, I protect my neighbor. I was in Michigan to visit some family over the weekend, and I was amazed to go into a grocery store and see almost no one wearing a mask. When I was out and about, I was seeing very few signs that people were taking COVID as seriously as they are here. And when I talked to my counterparts in states around us, and in some cases other jurisdictions outside of Chicago, even within Illinois, I think there is wishful thinking happening that COVID is over. It is not over. And now, more than ever, we need you all to do the things that have gotten us this far. I also want to thank people who are helping work on the root causes, the facts that we have seen this disease impact parts of Chicago, and particularly parts of Chicago that are heavily African American and Latinx more strongly. We've got folks working on improving chronic disease. I'm really excited to see, for example, the push to think about finally banning or limiting flavored tobacco, which drives a lot of the black-white life expectancy gap. I'm pleased to see progress in terms of connecting patients to care, making sure that they are in the preventive care that helps keep them from developing the more serious illness, and we will be doubling down on these efforts. So my promise to you as we look ahead as a city is that the health department and the city of Chicago are on this. I have teams looking at this data and using this data to drive resources where they are most needed 7 days a week, literally around the clock. We're pushing testing, resources, education, investigation where it is most needed week after week. We're working with the Race Equity Rapid Response Team with uncountable numbers of community and healthcare partners. And we've managed to keep this as one response so far. We will continue to safeguard our progress. We've not been shy about that. You heard the mayor talk about the enforcement that's been happening where we've seen businesses that have not been stepping up and doing the right thing. We've put the travel quarantine in place. That is about protecting our progress here, and we will not hesitate to make additional changes at a city level if we need to. But the best way and the biggest predictor of our progress here is not something that I can do or the mayor can do or Chicago can do. It's whether we as a city continue to do the behaviors that got us down to a moderate high risk, a moderate high incidence. I want to see that continue to drop. I know you all at this point know the things you need to do. And I ask you, please, to keep doing the things that have worked. We'll keep doing the things that have gotten us this far. And together we can be safe Chicago. Thank you.
Happy to take your questions.
Mayor, good morning. Chris Ty from CBS 2. A couple questions from our news organization first. As the mom who's not going to just turn the car around, but turn it off, the headline here today has been 18 to 29-year-olds and that we're teetering on 200 new cases a day. Can you talk at all about any policy that may emerge to be new tools in your toolbox to help address that in the near future?
Well, I think as Dr. Arwady said, we're watching every day, very closely, a number of different metrics, including new cases and where they're coming from. So part of what we've been doing as we started to see this increase, really that started a couple weeks back, is thinking about how do we really reach this age cohort. Difficult to do, because think back to when you were that age, we all thought we were invincible. But we've been thinking strategically about, well, where do this group of folks gather? What are the places where when they leave their home, outside of work, that they're at? So we've been placing a lot of emphasis on restaurants, bars, gyms, other places of entertainment, and really enforcing the message there that everyone who enters those premises absolutely must wear face coverings. Everyone who enters those premises must engage in social distancing. But that's clearly not enough, because we're continuing to see those cases go up. So we will be rolling out here shortly a specific targeted campaign to reach that demographic, the age demographic, but also targeted based upon race, ethnicity, and so forth. So we've got to keep bringing that message home. That's a big reason why we're standing here today. We hope that we don't have to take closure steps. But as the doctor said, and is now, I think, well known across the country, bars in particular pose a particular challenge. We've emphasized to bars, we're not messing around. You've got to follow the guidance. We've cited a number of different bars because they haven't followed that guidance. And just last weekend, we shut one down. We shut down I won't call it what I call it internally, the boat, because clearly they weren't taking things seriously. But we really need individuals in that cohort to understand that this disease does not discriminate. It attacks everyone, and right now the target is 18 to 29-year-olds.
Dr. Arwady said the first number she looks at every day is in the top left corner of that dashboard, and we're teetering on 200. We're likely, in her words, to get there again.
Yes.
Would that be the threshold at which point you would say we need to walk back the bar policy? Is that a binary thing?
It's not that simple, although, again, 200 is a number that we're very concerned about, which is why we're calling this out now. But as Dr. already said, there will be a number of different factors that roll up into that. It's not just purely the case number, although that's important. We got to look at where are the new cases coming, where are the areas that we're seeing those new numbers being generated, the demographics of the individuals in the new cases, if there's a particular kind of gathering that is producing these new cases. So it's more nuanced, as you would expect, than that. But yeah, 200 is an area, if we breach that and go over it consistently, it's going to be an issue of great concern to us.
A lot of questions from my colleagues. This is from Ryan Burrow at WGN Radio. Has the city issued any citations related to violations of the emergency travel order? How is the order being enforced?
Well, as I've answered this question on several different occasions, we looked at, as our model, other states, particularly on the East Coast, that had imposed this. And what we heard from them is that they had a substantial compliance rate. Now, are we going out and finding people that are coming from other states that are here in Chicago not quarantining? No, we are not, and we will not. But we will continue to educate people into compliance. It's very important that people understand, if you are coming from one of these states, and we just added 2 more yesterday, Iowa and Oklahoma, your case numbers put you at risk. And the best thing to do is really to stay in place. But if you have to travel and you're coming to Chicago, we do want you to quarantine. Doctor, do you want to opine a little bit more on that?
I'll just add, to put that in some context, the states that we've put that quarantine requirement on are states that have the equivalent of more than 400 cases per day, or what that would look like here in Chicago. So they're places that have an outbreak, at least sort of twice as many new cases as we're having here. And it's really, and in some cases, as much as 8 times the cases that we're having here. So if you look at Florida, you look at Arizona, they are, I think even just being in those states, frankly, is a significant concern for contracting COVID. Related to enforcement, I would say where we, first of all, again, thinking a little bit about the 18 to 29-year-olds, where we compare what's different about that group. We do case investigations, of course, for all cases. We know that that group also travels out of state, actually, more than any other group does. And that was happening prior to us putting this order in place, but that's an example of where we say, we look at the data, where are we seeing cases, what is different about that group? One thing that was quite different about that group was they were more likely to travel out of state. Again, not surprising based on the age group, but if there's a way that we can then structurally think about limiting that risk, we're going to take that example.
While I have you up there, a question from A.D. Quigg from Cranes. It appears testing numbers have fallen since July 9th. What's driving that?
No, that's not true.
No, testing numbers have not fallen since July 9th. One of the things that can be a little confusing, and if we look at this, if you're looking there, is that in the last few days always, there are delays in terms of when the test results come in. And so if you look at how we actually report tests, we don't use the last 5 days or so, because we never get a test result on the same day that it's done, and it's unusual for us to even get it the next day. In most cases, we're getting it 2 to 3, but sometimes up to 5 or 6 days later. And so we never include those last few days in terms of our case numbers. Overall, our testing numbers, I should say, are really the highest that they've been and continuing to grow.
Okay, thank you. Mayor, this from Alex Keefe at WBEZ. You said yesterday that CPS may not announce reopening plans until late August.
No, that's not what I said. Let me just be clear, because I think there's been some miscommunication about that. What I said is that soon CPS will announce a framework and start a more robust discussion with relevant stakeholders. What I also said is that we won't know whether or not CPS can actually reopen for in-person until much later. We're not going to make that decision in mid-July when school doesn't reopen until after Labor Day. But we will begin the discussion with parents and stakeholders. Look, I'm a parent of an elementary school kid. I was out with some of the moms from our school last night, and the primary discussion was what's going to happen with schools. I know that this is a conversation that, of course, parents are anxious about, they want to know about. I understand it completely as the mom of an elementary school child. That's why CPS is going to be starting this conversation now in order to get the views and the reactions of parents, teachers, staff. Everybody in the school community needs to be part of this discussion so we come up with a range of options and flexibility in the event that we are all able to open school.
And I guess the essence of his question is making sure parents have enough time to plan. Is that factoring into this discussion?
100%, which is why we're starting this discussion now.
Kelly Bauer at Block Club. It's been said cities need to keep their positivity rate or below 5% to get kids in school. Chicago's already at 5%. Will officials look at closing businesses like bars or taking steps back to prevent further spread so kids can be back in the fall? And you've kind of answered that.
Yeah, I think we've addressed really both of those questions.
She also asked if cases continue to rise, would Chicago automatically revert back to stay at home as other cities have, or would we merely close some businesses again?
And I think we've addressed that question as well. We are looking every single day at a range of different metrics, including new cases, and if we see an uptick, if we go above 200, of course we're going to be interested and concerned about what's driving those numbers, and then we will take measures as appropriate to address particular areas where we're seeing the cases, new cases coming from.
Fran Spielman at the Sun-Times. You've joined a group of mayors in a letter urging Congress to approve replacement revenue to cities and warning of the dire consequences if you don't get it. What exactly are those dire consequences?
Well, I mean, I think everybody knows what those are, but our hope is that we will get new relief from the federal government. I've spoken recently with Senator Durbin, for example, along with a mayor of another city that's much smaller than Chicago. We've talked about the impact of closing the economy on local revenues, on our budgets, and that we desperately need new resources from the federal government that we can use for revenue replacement. The CARES Act money, which is extraordinarily helpful, but that is only money that can be used specifically for COVID-19 response. What we need, all of us, of cities and villages of all sizes, is resources to help us address the revenue shortfalls that have arisen as a result of the economic shutdown.
Last two questions.
Okay, let me bounce around. There's a few others. Our friends at CBS Network have a question. There's growing concern that air conditioning systems can play a role in spreading the coronavirus as it heats up here, as it remains hot here. Are you concerned? And if so, what are your main worries?
I'm going to defer to the doctor on that question.
So most of the information that we have related to structural things that can potentially drive COVID spread are more related to ventilation as compared to air conditioning. So there is very specific guidance that the CDC has put out and that CDPH and the city have pushed out, particularly to larger businesses that would have large-scale ventilation or air conditioning systems in place. The bottom line is you want to do what you can to increase air exchanges with the outside. And so our big buildings here in Chicago have done that. At an individual level, I want to address this because I think particularly with the heat and with, 25 years post, our really significant heat wave here, I want to be clear that it is safe and appropriate for individuals to use air conditioning in their apartments or in their homes. I am not concerned about a window air conditioner or an air conditioner in a residential setting being a source of COVID spread. I would apply the same guidance that we give to the large buildings to individuals, that a really good way to decrease any potential risk of COVID is just to open your window, open your door, have additional airflow running through your apartment or through your home, and broadly letting the outdoors in has turned out to be one of the more important things for limiting the risk of COVID in buildings. So I don't consider air conditioning the major concern.
Thank you. Mayor,
Last question.
I understand this is the last question. If I can just ask one about CPD and one about CTA. This is from Mike Lowe at WGN. What is your level of concern about the 10 positive cases at the police academy? Should CPD consider moving most police academy training online? And one from John Greenfield asking, we're seeing a spike in crime on the CTA with at least 8 violent robberies on red line platforms. Last February, on the day you announced an increase in policing on CTA to combat crime, officers were shot and critically wounded. Would you consider a new program? So one on CPD, one on CTA.
Well, we follow, I'll take the CTA question first. We follow what's happening on the CTA very, very carefully, and we made specific structural changes to address what had been a 3-year uptick in crime on the CTA. I think those new changes that we put in place, much more accountability on the part of officers and supervision, have actually served us well. Obviously, anytime we have crime anywhere, it's a concern, and we'll continue to work with the CTA as well as the CPD to make sure that all of our train travel is safe. Regarding the cases, look, the reality is no setting is risk-free, and we've been relatively fortunate here in Chicago about the amount of spread that we've seen among our first responders. And while we lost, I believe, 5 first responders in the early days of the COVID spread, which is obviously a terrible tragedy for the individual families, and been very hard on both the fire department and the police department. I think what we've seen in recent weeks and months is a significant decrease in the amount of new cases amongst our first responders, fire and police, and we haven't had any reported deaths related to COVID in quite some time. That's because both of those departments have spent a significant amount of time working with the Department of Public Health to implement testing and training and education for individual members to teach them how to keep themselves safe, to make sure that they've got the equipment they need to be able to do their jobs. And I've been extremely diligent and pushing both the fire department and the police department to make sure officers who are coming in contact with members of the public have the proper equipment that we provided them, that they're actually using it.
And a quick follow-up, if I can, related to CPD. This is from Amy Jacobson at WIND. Yesterday, CWB Chicago released video of the census cowboy making disparaging remarks about Chicago police. Have you seen that? And are you going to keep him as a volunteer, reprimand him, or let him go?
Well, I saw a video from April. And look, the reality is what we're trying to do is raise the heightened awareness around the census. That's the most important thing. And we're going to be doing everything that we can to make sure that people understand the importance of the census. There's a lot of other things that we're going to, and tools that we're going to employ to raise the consciousness of folks in the census. This could not be more important. A lot of the things that we're talking about, and you asked a question earlier about revenues from the federal government. If we are not counted, we do not get our fair share of dollars from the federal government. Pure and simple. Everyone needs to be counted. We need to raise our rates above 55% where we are now. We still have some time to be able to do that, and we're going to be using a lot of different tools to make sure that people understand 5 minutes means resources to Chicago for schools, for roads, other infrastructure, the things that are important to us to build a great, strong, vital economy. The census is the gating tool.
So you'll
Thank
keep
you,
him a
Mayor.
will you
Thank
just-
you.
Will you keep him or reprimand him?
Thank you, everyone.